I am Sutay Adade from the Gambia, West Africa. I am a staff of Edward Francis Small Teaching Hospital. I'm working under the surgical department. I have 5 years working experience, and then I have been I'm recommended by the First Lady's office to come and attend this training on the Merck Foundation in India. Basically, looking at cancer in general in our country, we have cervical cancer, which is the most common prevalent in our country, and then it occurs in the ages between 15 to 44 in most women, which is second by breast cancer. It accounts for an incidence rate of 15%, and then with a mortality rate of 50%, which exceeds more than 50% in 2020. So basically, these are the most common cancers we have. And then the treatment protocol, most of the treatments are done in the urban centers. So if we have patients from the rural areas, they have to move to the urban to seek for treatment. Most of the times with people in the provinces, there is this lack of awareness in general about cancer. So most of the times we face problems of early detection. Some will have these cancers and then they will be in the provinces for like years until the cancer passes the initial stages, and then that's the time they will come to the urban areas for treatment when it is already late for them. We actually didn't have much specialist oncologists in the Gambia, and then cancer care nurses again are very, very limited. But with the help of the Merck Foundation training, they are recruiting more nurses from our country to come and attend this training in India and other parts of India, in Tata Memorial and other parts of India. So I believe now the number is increasing because so many people have an opportunity to come and attend this training and then go back to their country to serve their people. The two important things that are very, very crucial in improving cancer care in the Gambia will be, the first thing will be to raise awareness, that is awareness campaign, both in the rural and urban centers. You raise awareness on the early detection of cancers. The cancer screening should be conducted in all areas in the hospital. And then sensitizations also could be done in the schools, hospital visits as well. So this will be able to help in detecting cancers and then intervening at the initial stage. The facilities are not much. Most of the times, patients prefer to visit the last referral center of the country, which is Edward Francis Small Teaching Hospital. And then it's one of the biggest hospitals in the Gambia. And you have other hospitals like Kanifing General, you have Buyam, and then a hospital also in Bansang, General Hospital. But in all these hospitals, they actually detect and then refer to Edward Francis for further management. So basically, Edward Francis is the main center of cancer management. Edward Francis will actually refer patients who can afford treatment, like in foreign countries. They will recommend to patients, and then those that can afford will actually go further and then go to another country for a treatment. But those that cannot actually afford will still be in Edward Francis and receive their treatments there. Merck Foundation training is actually very, very important for me because it has helped me to acquire some new knowledge, skills, which I will be able to implement back home, and then that will improve patient care in my hospital. From the time I came, I was able to start from the preventive side of oncology, and then there I was able to know like the preventive measures that could be taken to avoid cancer, and then some of the early signs and symptoms of cancer in different types of cancers as well, and then the different treatment options like radiotherapy, chemotherapy, then surgery. Yes, I was able to know everything when I came. Since I came, I was able to see head and neck cancers, and then gastrointestinal cancers, and also breast CS, cervical CS, and bones and soft tissue cancers, and then blood cancers as well. The training will actually be of help when I am back in my country, because I will raise awareness among the people that I rendered care to, and I will also be able to do screening, cervical cancer screening or breast cancer screening for the entire population. My advice to the new healthcare workers that will be coming to Tata or any other part of India for a training is to take responsibility. This learning procedure, this training as their own, to take responsibility of everything, and then know that it's adult learning, and then they should involve themselves as much as they can to be able to acquire new skills and knowledge. For everything is being provided in Tata. You have so many facilities here, both infrastructurally and then technical are all in place. So they could involve themselves and then be able to learn. I would definitely like to extend my deepest appreciation to the entire Merck Foundation, to the staff of Tata Memorial Hospital, and then to anyone that has actually participated towards the success of this training. I'm saying a big thank you, because their willingness to invest in this training has definitely impacted a lot in my life, and then I'm saying a big thank you to them.